My name is Sarah Weller and I'm the Global Director of Prostate Cancer at Movember and get to oversee all of the impact work that we do that's focused on prostate cancer.
And my name is Kris Bennett. I am the Director of Prostate Cancer Health Equity.
At Movember, we've been involved in work to improve the lives of people with prostate cancer for over 21 years now. Movember started in Melbourne, Australia, in a bar with three guys hoping to have some fun and grow some moustaches, and then realising that they actually wanted to have some impact with that as well. And this phenomena just took off, this movement really took off. And so over the years, we've been able to raise over $1.5 billion through our Movember campaigns. And we've been able to really invest that money in helping people with prostate cancer, with mental health concerns, suicide prevention, and testicular cancer, to really try and improve men's health globally. With prostate cancer right now, we're really trying to improve the lives of people who are living with prostate cancer and also to prevent men from dying from it. So that's really what our work is focused on, and a really large portion of that is health equity. So really trying to reduce the inequities and disparities that are experienced by people who have prostate cancer and by those around them. Movember's present in over 20 countries globally. The main countries that we do a lot of our impact work are Australia, New Zealand, the US, the United Kingdom, Ireland and Canada, as well as a lot of Europe as well. It's really grown throughout the years, over the last 21 years, and we have a global team. Kris is part of that global team and is based out of the United States, focusing on health equity. And we really try and make sure that the work that we're doing isn't just impacting those who are based in Australia, but really within our whole global vision.
We're starting to claim back that space to celebrate what it truly means to be an Indigenous man.
At Movember, we're defining health equity as the opportunity for everyone to have a fair and just chance at attaining their highest health. The inequities, especially in Australia, are really focused on four major priority areas, and those are going to be the culturally and linguistically diverse populations. So those are going to be folks who are facing barriers to the language that they're speaking. It's also going to be pieces of health literacy that come up there, and then of course those are some of the systemic pieces as well. There's also the rural and remote communities that exist. So we know that a lot of the population has access to good care here, but the remoteness in Australia in particular is very, very massive. So those are going to be the folks that are really have limited access to specialist care, and that's going to result in lack of testing, as well as higher mortality rates. The other population that is really important to mention here is the LGBTQIA+ community. So those are folks that are really facing a lot of those stigmas that exist in this space, and also really do have significantly lower prostate cancer screening rates in compared to their counterparts. And then the last piece are the Aboriginal and Torres Strait Islander men.
In Australia, we've got 3 grants that we're awarding that make up the $800,000. And these include 3 really different initiatives, which is quite exciting with how we might tackle some of these inequities and disparities. The first is with the Royal Flying Doctors Service, and that's taking a focus on remote and regional inequities. And Kris can speak more to kind of the work that the Royal Flying Doctor Service is going to be doing.
Yeah, absolutely. So their major goal is really going to be looking to identify those factors behind those geographic disparities that exist, and really looking to help develop some evidence-based interventions. And so when we think about the remote piece, I think most folks know that remoteness is a massive barrier to care. So this project is really awesome because it's actually going to be able to give us some of those actual evidence-based pieces to kind of solve the puzzle.
With the Royal Flying Doctor Service as well, what a lot of people might not realise is they're a really critical component to improving access to care for people with cancer when you're living, outside of a metropolitan area. And they do thousands of flights each year getting people to their treatment. So they're really well positioned to work with the community and help uncover some of the real drivers of poorer outcomes in people who are living remote. they often have different decisions to make because they have to be away from their family often for this treatment, which is quite different to when you're living in a metropolitan area. The second grant that we're funding is with the George Institute for Global Health. And the George is really focused on the COLD population, so culturally and linguistic diverse.
The George Institute for Global Health is really focusing on closing care gaps that are experienced by integrating migrants, as well as the pieces around ethnicity and health data.
What's interesting, I think, about the George and the work that they're going to be doing is they really highlight that if we can't measure it and understand what's going wrong, it's really hard to address the issue. And so they're really positioning this work to start to really uncover a lot of the drivers of these disparities for the COLD population, because there's not a lot of evidence out there right now, and they'll be doing that with that community as well. And then the third grant that we're funding is with the Australian Prostate Centre. This is a really interesting group that's actually based in Melbourne, and they're going to be working with the LGBTQIA plus community.
Stigma is a big piece, and especially when it comes to the LGBTQIA population, folks are always dealing with the stigma around prostate cancer and the stigma around care. So this specific work is actually focused on kind of reducing some of those stigmas that exist, increasing screening rates because we know that screening rates are lower in this specific population, and then really driving some of those system level changes that we would hope to see.
And what people might not realise is that with prostate cancer, while we're really good at keeping people alive with the treatments, the treatments are phenomenal now and survival rates are really high. The challenge is actually having good quality of life as you live for sometimes decades with the after effects of treatments. And that can be things like sexual function challenges, it can be mental health concerns, distress and depression and anxiety, it can be urinary incontinence, a lot of things that really impact your day-to-day function.
We're here today to officially launch the Real Face of Men's Health report at Parliament to talk about our 3 policy asks. The first being strengthening men's health literacy. The second focused on the health system and that it is gender responsive to men's needs. And the third is improving our research to understand how and when men are engaging with the system. All 3 of these policy asks can be met if we fund the men's health strategy.
Movember's really committed to changing the face of men's health, and we can't do that without really strong partnerships with clinicians. Most of the work that we're doing that you'll see in our community is led with and by our subject matter experts, which are often urologists, medical oncologists, and other physicians who are based in the community. So it's a really important component of our work. For these grants, as an example, our review panel was made up of clinicians and some academics in the health equity space within each major market that we were working within. One of the big things that I think clinicians can do is really get involved. We really try and involve and engage medical professionals, healthcare providers in all of the work that we're doing. Just last week we had a convening with healthcare providers for sexual health and wellbeing, one of our other initiatives that is really trying to improve the standard of care that's focused on sexual function, wellbeing and intimacy, including health equity components and considerations. And that room was full of physicians, of nurses, of allied health professionals. And so we're really interested in engaging people as best as possible. If there was one key call to action, I think it would be for people to ensure that they're aware of the quality of life impacts that the treatments for prostate cancer actually have on the men and their families that we're trying to help. And as a clinician, I believe that this can be done by ensuring that the person in front of you, the patient that you're serving, has the information they need to make an informed and a shared care decision with you about whether they're most appropriate to go down an active surveillance pathway or whether they really need to have surgery or radiation in that moment. We know those after effects of surgery and radiation can provide terrible quality of life outcomes and produce issues that men and their partners are dealing with for decades. So I guess our big call to action will be to have that conversation and ensure that that happens with all men. Let's not make assumptions. Let's make sure that we're actually starting that conversation with them as early as possible when they're in the room with you. Something that we're trying to do through these grants is build some of the case for change and some of the evidence so that we can start to improve the policies and legislation that are driving some of these inequities and disparities in each of these countries. We know that the health system is currently not serving everybody appropriately, and we want to help to change that, but we need the evidence to best support that change. And so from this work, we really expect to see some fairly big policy asks of government once we understand the information a little bit better, to really help improve our system so that it can be a system that drives health equity and is fair and just for all.